We continue, dear students, with Dorothy Orem's self-care theory. You must have heard about it, but just we'll review. She was born in 1914 in Baltimore, US, earned her diploma at Providence Hospital, Washington, D.C. 1939, she did a BSNE education in Catholic University of America. 1945, she did the MSN education in the National University of America, and she worked as a staff nurse, private duty nurse, nurse educator and administrator, and nurse consultant. Received honorary Doctor of Science degree in 1976. Theory was first published in Nursing Concepts of Practice in 1971, second in 1980 and 1995 and 2001. Now going on to Dorothy Orem's self-care theory, she says that people should be self-reliant and responsible for their own care and others in their family needing care. People are distinct individuals. Nursing is a form of action, interaction between two or more persons. Successfully meeting universal and development self-care requisites is an important component of primary care prevention and ill health. A person's knowledge of potential health problems is necessary for promoting self-care behaviors. Self-care and dependent care are behaviors learned within a socio-cultural context. Now there are various definitions of domain concepts. Nursing, she says nursing is an art, a helping service and a technology. Actions are deliberately selected and performed by nurses to help the individuals or groups under their care to maintain or change conditions in themselves or in their environments. Encompasses the patient's perspective of health condition, the physician perspective and the nursing perspective. The goal of nursing to render the patient or members of his family capable of meeting the patient's self-care needs, to maintain a state of health, to regain normal or near normal state of health in the event of disease or injury, to stabilize, control or minimize the effects of chronic poor health or disability. These are the goals of nursing. Then you have health. Health and healthy are terms used to describe living things. It is when they are structurally and functionally whole or sound. Wholeness or integrity includes that which makes a person human, operating in conjunction with physiological and psychophysiological mechanisms and a material structure, and in relation to and interacting with each other human beings. Environment components are environment factors, environment elements, conditions, and developed environment human being has the capacity to reflect, symbolize, and use symbols. Conceptualized as a total being with universal developmental needs and capable of continuous self-care, a unity that can function biologically, symbolically, and socially. So that is all about human beings and health. Third important concept in this theory is nursing client, a human being who has health-related, health-derived limitations that render him incapable of continuous self-care or dependent care, or limitations that result in ineffective, incomplete care. A human being is the focus of nursing only when a self-care requisites exceed self-care capabilities. Nursing problem is the next concept. Deficits in universal developmental and health derived or health related conditions. Nursing process is a system to determine why a person is under care, a plan for care, the implementation of care.